Okay, folks, let's go ahead and get settled so we can be respectful of everybody's time. My name is Kevin Lang. I'm an assistant professor in the Department of Veterinary and Biomedical Sciences here in the college. Through my service with the research committee, the Collegiate Research Committee, I help organize these events every month. As many of you all know, One Health Day is in November every year. This year, it fell on a Sunday, which is not exceptionally helpful for all of us. But we wanted to have an event that sort of brought everybody together under the One Health umbrella. As many of you all know, One Health is a conceptual framework where human, animal, and environmental health are all connected in various ways. And today we're going to explore how those aspects are all influenced by our changing climate. So welcome. Our moderator today is Dr. Kent Reed, who's professor and chair of the Veterinary and Biomedical Sciences Department here in the college. Dr. Reed has been studying poultry production for many years and has recently started to explore how poultry production is impacted by rising temperatures. And so I'm going to keep it short and hand it over to Dr. Reed. So thank you, Dr. Reed, for moderating.
All right, thanks, Kevin. So a little bit about our format today. I've got a few introductory comments and I'll obviously introduce our panelists. We've asked them to just kind of speak briefly about sort of what they do and how that interacts within the climate space, if you will. And then essentially turn the floor over to you for questions. So the idea is here is to have a sort of an interactive time this afternoon. And hopefully sort of drill in on the topic a little bit. So climate change obviously is altering the places where we live, we work, we recreate, and often, for example, when we think about climate change, we think about the big impacts, right? The challenge to the polar ice caps or the frequency or severity of hurricanes, right? But we also know that we're already experiencing some of the effects of climate change even here in Minnesota. In fact, Minnesota's average annual temperature has increased nearly 3 degrees since the 1800s. Now you think, well, maybe that's not a lot. But climate science research suggests that the state not only will continue on this track, but will continue to get wetter and warmer with more frequent and extreme events driving changes across not only the state, but obviously the Midwest region. Just contrast, right, even this summer, the real wet June we had versus this past September, where essentially we got no rain, right? So the temperature extremes we're already seeing. Think about the last 2 winters, right? 2 winters ago where we were like number 3 for snowfall, and then last year where, basically winter didn't happen here in Minnesota. So our winters are warming dramatically. Spring is arriving early and much earlier, up to 2 weeks now than it did in 1900. So in just 100 years. So changes to Minnesota climate are altering the way we grow food as the climate change impacts both animal and plant growth, right? And does that through a number of factors: temperature, humidity, cloud cover, precipitation. Climate change is also having a profound impact on Minnesota's natural environment. Right, so Minnesota lies at the convergence of really 4 different climatic zones. The aspen parklands, the prairie grasslands, and then the deciduous and coniferous forests. In many of our states, iconic native plants and animals are threatened as the ranges of not only plants and animals change, but also their commensals and the pathogens shift due to climate. So today our discussion, right, again, the area of One Health is very broad. But we're looking at the intersection of climate change and One Health, and we're going to essentially consider some of the challenges then to health around climate change. We've got 3 panelists today representing the field of medicine, public health, and veterinary medicine. And again, these are individuals whose research touches on one area of public health or another. First, going right to left here this morning, or this afternoon we're now at, Dr. Alexandra Zachwieja. Zachwieja, yes. I asked her about that and I knew it was going to be tough. She's an assistant professor in the Department of Biomedical Sciences at the University of Minnesota Duluth. She's a biological anthropologist, a species distribution modeler, and a National Geographic explorer. Her research broadly focuses on how climate change has affected humans in terms of their mobility, access to resources, interactions with other species, and of course, health. She's interested in how climate change affects these social environmental systems on large timescales and has worked on climate change and human evolution in Southeastern Asia, as well as determining how climate change presents acute health risks in permafrost regions. In the middle, we have Matt Aliota. Many of you recognize him. He's associate professor here in the Department of Veterinary and Biomedical Sciences in the College of Veterinary Medicine. The overarching goal of his research is to better understand how arthropod-borne viruses overcome evolutionary barriers to emerge and cause disease in humans and animals. His group adopts a variety of approaches to answer questions that span multiple scales of ecological organization, from within host processes to population and community level dynamics to better understand how viral genetic variability, pathogenesis, and transmission are linked. A current area of emphasis in his program is to better understand how environmental change, including climate change, will affect arthropod-borne virus transmission. And finally, on the end, Dr. Kyle Hill is of Ojibwe, Dakota, and Lakota heritage. He's an assistant professor at the University of Minnesota in the School of Public Health in the Division of Environmental Health and Science, and is also an adjunct faculty member at the University of North Dakota in the Department of Indigenous Health. Dr. Hill is active in the community-based participatory research in American Indian and First Nation communities in the US and Canada, with projects on social, behavioral, and environmental health. Specifically, he works at the intersection of climate justice and land-based healing within Indigenous communities, and is also exploring how Indigenous traditional ecological knowledge can function as foundations for climate adaptation and mitigation programs. He's authored a number of works that on the impacts of climate change to Indigenous health, particularly impacts on community mental health. And he currently lives with his family on the Dakota and Anishinaabe traditional homelands here in St. Paul. Those are our panelists. So please welcome them this afternoon. So I guess you guys can decide who wants to go first, but an opportunity to just sort of say a few words about what it is you do and research and what interests you with regards to the impact in One Health and climate change. And we've got a mic you can.
Can everybody hear me? Cool. Yeah, so bonjour, everybody. Good afternoon, I guess. I'm really grateful to be here with you all today, especially around this issue of One Health. As was mentioned, my work primarily concerns that intersection of climate change and Indigenous health, and really looking at the mental health impacts of climate change. And I think what's unique about Indigenous communities is there's an innate kind of One Health or planetary health approach to our Indigenous communities, especially as we practice our traditional life ways and cultural life ways. And so I feel like it's just a natural space, for most Indigenous community members to, do our work. So my work, is around recognizing these traditional life ways and how they correspond to climate adaptation and mitigation programming, how they could best be leveraged in those spaces. And you may have heard the concept of like two-eyed seeing approaches, which is essentially taking, the best of our natural science approaches, for modeling
early warning systems, and then alongside kind of indigenous traditional knowledge systems, and kind of combining those with an interdisciplinary fashion to develop adaptation programming within our communities. And so far, it's kind of been a really fruitful opportunity for a lot of communities to do like restoration on lake beds. For example, one of the things that I'm primarily interested in is like how some of our traditional stories kind of highlight a lot of our relationships and kinship to some of the animals and some of the plant medicines that we see here in the Midwest and Great Lakes region, you know. And so, for example, I think something that's really particularly interesting to me is how our Anishinaabe relatives are historically very much tied to our wolf populations. And so it's more of like a kinship, you know, and similarly on my father's side as Lakota and Dakota people, we're so closely tied and intertwined with our bison populations, you know, so much that we call them Pateoyate, so it's really Buffalo Nation. And so what was fascinating to me along this trajectory is noticing how as the buffalo population or bison population declined into the 19th century, so too, through assimilation periods, through genocide, the American Indian population declined as well into the 19th century to about 250,000 by 1890. And so is that a coincidence? You know, people might say that is a coincidence, but yet what I do think about in terms of climate change is I think the problematic kind of our reliance on beef and American diets, you know, and then the global warming, the greenhouse gases that are, you know, a result of our over-reliance on beef, you know. And then we see the buffalo restoration that is happening, you know, across Montana, South Dakota, into Canada, North Dakota, and the biodiversity implications, the improvement in these grasslands and prairies from the buffalo restoration projects, you know, that in and of itself is a climate adaptation program. And so that's kind of, in a nutshell, that's a little bit of my interest in kind of the work that I'm doing and helping steward with other communities. Some more recent work that we've done, we've had publications on climate change, indigenous knowledge systems, and health. That was published, you know, this past year. Helped along with a publication in The Lancet on xenophobia and racism in between global north and global south communities, particularly around the fair share approach to CO2 and global emissions. Disparities between a global north and global south and the implications there for what was termed atmospheric colonialism, because the global north is more responsible for emissions globally. And so we see that in kind of loss and damage funding, especially as it's, you know, in COP29, you see some things coming out around that, like who's going to pay some of these countries that have far below their fair share of emissions, and yet have the most, are suffering the most consequences and health inequities globally. And what else? Right now, we recently got P20, which is a developmental center grant through the School of Public Health with with the Institute on the Environment for Climate Change and Health, but we're focusing on indigenous community health as well as rural communities in the region. And so as the community engagement core lead, we're just kind of, you know, launching that. And that's a really exciting endeavor and opportunities. There'll be pilot grants out for those of you who are students, postdocs, faculty, to look at some of the areas that we're discussing today, you know, in relation to, you know, what are we looking at? Are we looking at harmful algal blooms in some of our lakes that are keeping recreation? You know, it's kind of scary out there, especially for some of our animals, for us certainly. Lyme disease, for example, is another example where we can look at, some really important research. And then certainly at the intersection of human health and plant and animal health, which is the One Health approach. So there's really exciting opportunities to come from that. What else? I think I'm going to stop there. And I know I didn't take up the whole 10 minutes, but I've reached my limit of talking where I'm just going to start going, and yeah, so I'll stop there. Thank you. Yeah.
All right, so as Kent mentioned, I am a virologist, and specifically I study arthropod-borne viruses. And so we shorten this in my field to the term arboviruses. And so arbovirologist, which is the type of virologist I am, I think I can make a pretty strong argument that we are some of the OG One Health scientists. We were doing One Health before One Health was cool. And so fundamentally what my lab studies is how these viruses evolve within hosts and during transmission between hosts. And so we do this to understand how they cause disease and fundamental disease processes in vertebrate hosts, but also in their arthropod vector. I study mosquito and tick-borne viruses. And so not surprisingly, these arthropod vectors are significantly impacted by climate and change the climate. And so the kind of most important aspect of transmission for these viruses is the ecology of the mosquito or tick vector. And so where these mosquitoes are found, the viruses follow. And so the example that I will just talk about briefly are viruses like dengue virus, which is transmitted by a mosquito called Aedes aegypti. And so we're seeing explosive outbreaks, that unprecedented outbreaks in parts of South and Central America currently with dengue virus right now. And so this mosquito that transmits this virus is really geographically constrained because of climate conditions, and specifically because of temperature. It's a tropical mosquito species that's found throughout the equatorial tropics. We have populations of Aedes aegypti in the United States, along the Gulf Coast, in parts of the southeastern United States. But right now, it can't move really any further north. Minnesota's cold winters are good for something, although, as Ken mentioned, they are not as cold as they used to be. More concerning is a closely related mosquito species called Aedes albopictus, which is, again, kind of a globally invasive mosquito species that's found on all inhabited continents. It has a far more temperate distribution. There are overwintering populations of Aedes albopictus right now in southern Wisconsin, in northern Iowa. We find Aedes albopictus in the Twin Cities metro area through kind of normal surveillance every summer. Don't think they're overwintering yet, but this mosquito also can transmit viruses like dengue virus. In fact, right now in France and in other parts of Europe, there are local outbreaks, unprecedented local outbreaks of dengue virus that are being driven by Aedes albopictus. And it's not just temperature. Other factors related to climate can impact mosquito-borne virus transmission. Think about things like humidity and water usage. We think about how the urban environment or the rural environment even is changing as the climate in the globe gets hotter and warmer and wetter and ultimately sicker. And so it's not just mosquito-borne diseases or tick-borne viruses. It's all infectious diseases are linked to climate and change in climate. And I think we are moving into a time period where we are going to be experiencing a warmer and sicker world. And so we keep that context in mind as we design laboratory experiments to try to make observations about what is going on in the world, bring that back into the laboratory where we can simulate conditions out in the natural environment to see how these changing conditions might impact things like virus transmission, virus evolution, whether or not you're going to have different spillover into new host populations. So as the equatorial tropics warms, there have been modeling simulations that suggest that, animal species are going to move away from the equator towards the poles, and you're going to all of a sudden now have these species interactions, these new species interactions that have never occurred before, and then exchange of viruses and other pathogens, and how is that going to drive epidemics or potential for epidemics and pandemics in the future as well. And I think I'll stop there.
Hi, everyone. Thanks for having me. It's good to be here. I just came down today from the Duluth campus, so that's where I am. I'm up in the medical school there in the Department of Biomedical Sciences, but I'm actually a biological anthropologist. And I kind of had an interesting journey to get here and to work in a medical school. Primarily, the reason that I ended up here and that I came here, and you'll find many an anthropologist in a medical school, is that we are kind of serial generalists in the human body, the human condition, and in human evolutionary anatomy. And so that's what I do up there. I sort of run the human gross anatomy program for the students. But my research is sort of related to this broad timescale human interaction with the environment. And so I've been working now in Southeast Asia on some human evolution digs and research in Laos at the Tampaling, the Cave of the Monkeys, for about a decade. And so I've been over there a bunch of times, and really my piece there stemmed from an interest in thinking about how humans moved into and through that space of Southeast Asia to Australia through lots of different climates, lots of different things, and through periods of major climate change, like the last glacial maximum, which is about 25,000 years ago. And that was kind of the last, in maybe a reverse direction, aiming towards cold, the last sort of huge period of intensive climate change in our deep history until what we're experiencing now. And I was really interested in not only the human aspect of that, but in kind of removing this idea that can be very strong in paleoanthropology of human exceptionalism, right? Being the apex predator and the one that evolved everywhere and the one that can go everywhere. And truly, I think that misses a lot of the fact that we really just are another creature on this planet that has dealt with things in the same way that all other creatures have dealt with those same things. And so part of my work there was specifically interested in, as humans moved into that space, how are they interacting specifically with other carnivores in that region? You know, kind of as you just mentioned, like when you have a species move into a new space, how do these interactions occur? What happens? How do things work? And so essentially what I have been doing and what I started with my work there was ecological niche modeling, or species dispersal modeling, sometimes it's called, which is a pretty common method in wildlife biology in studying disease vectors, for example. But it's rarely applied to people. And so I ended up doing that, specifically thinking in what was the relationship in that vastly changing climate over about 10,000 years, and in the sort of biotic species interactions that were happening for the first time. And so I'm still investigating that. I have a lot of theories. For example, the big one being that humans are great at cooperation. And what we actually see as humans move into Southeast Asia and through there at this time is a disappearance of another really good cooperative hunter, the Asiatic hyena. So I have some thoughts, and I do think it's really interesting. And I think there's a lot of combining factors of how, you know, our species moved into there at a very specific time in climate change and interacting with these species to live and move through this space. Once I came to the med school in 2019, I started having much more of a vested interest in current and future climate change, right? I think, you know, it's easy to see that it's happening all in front of us. And while I love my work in the past, there's something in me that needs to think about and do something about what's happening right in front of our very eyes, you know? Also just some specific One Health things in my life and family. One of the years that I was in Laos in 2016, our entire team got horribly ill. Went through a ton of tests, went to a bunch of places. About 6 months later, we found out it was chikungunya, which is another mosquito-borne vector. And at that time, it became very obvious to all of us, and we're an international team all throughout the world, that globally we were not prepared to handle disease vectors popping up in places that they weren't expected to be. And so at that time, you know, we were kind of told, if you want more answers, you'll have to go to the CDC in Atlanta. And that truly is not a sustainable thing, right? And, you know, things have changed since then, but another one being Lyme disease. Lyme disease, I come from central Southern Illinois. There's a lot of Lyme disease there as well, chronic Lyme being a major stressor. And so coming into the med school here, I really wanted to kind of use the skills that I have in climate hindcasting and species interaction and kind of flip those methods, same methods, but do it into the future. And so recently I've been working now for about 3 years on a big collaborative project in Alaska, which is looking at the impact of climate change affecting permafrost thaw and what that means for infrastructure. And this is a big multidisciplinary team with a lot of engineers, people devising up new like biodegradable things to help the roads not thaw. But I'm truly there as a social scientist to say, infrastructure is not just roads and bridges. It's also very important things from the community like community gardens or cemeteries, right? All of these things that are also being affected by and eroding from climate change that are real community concerns and are affecting daily lifeways that are not being accounted for when we think about the true cost and buy-in of doing these types of climate mitigations. So that's what I've been working on recently. Specifically now moving into a lot of the community brought forward concern of these thawing permafrost-bound grave sites, some of which go back to the early 1800s and contain a lot of different large epidemic swaths, right? The 1918 Spanish influenza being one of those that I work on. And these are truly eroding out of the ground up there. And so my team, in context with some other folks up there, using that anthropological and forensics experience, is kind of on the ground trying to figure out how do we safely deal with this huge problem and what can communities do to be safer. And sort of stemming from that, I am really big into multidisciplinary research on climate change. I think that's the way that we're going to be able to tackle anything, is we need to talk to each other and work together and listen to each other. And so it's been actually a really lovely, eye-opening experience for me to be in the Department of Biomedical Sciences there with a lot of wet lab bench researchers and thinking about how we can devise new collaborations. So there's a couple of those up there that are truly in their infancy, but I just want to mention them as sort of potential future directions. There's an immunologist up there, Dr. Ben Clark, who has been working now for probably 10, 15 years on a public-facing tick education project up there. And we know that in St. Louis County, in a lot of the ticks that he's collected and sequenced their gut microbiome, about 20% of the ticks in St. Louis County carry the Lyme disease causing spirochete, but next door in Carleton County, it's about only, 50% as compared to 70% of the ticks carry it. And like, why is that, right? So thinking about, are there more sort of local microenvironments, local knowledge that could help understand those differences and help utilize that in a way that would be effective for public health. And then lastly, and then I'll hand this off, there's some other researchers up there who are amazing researchers, Dr. Sabrina Scroggins and Dr. Jean Riegel, who look into preeclampsia and pregnancy. And one of the things that can really increase risk factors like preeclampsia, like cardiovascular health outcomes during pregnancy is heat. And as we all know, right, our summers are getting way hotter. They're more sustained. These heat waves are longer. And to date, there's not a ton of multidisciplinary, cross-disciplinary work that truly goes from the sort of community, public, large-scale climate modeling down to the mechanistic work that's happening in the lab and trying to connect all of that. And so that's one of the things that we're hoping to start thinking about as well is how can we intentionally form some of these multidisciplinary connections to really start to link all of these different silos of work into something that might be useful broadly in the future. So that's kind of what I've been up to lately, and I'm going to hand it off.
You can keep the mic because we're hopefully going to need it here. So obviously you see we've got a broad range of expertise here in an interest. And the idea now for the rest of the time is to allow you to tap into that a little bit. Obviously, if you have questions for the panel in general, or we're willing to take those. If you've got questions for one of the individual panelists, then by all means, somewhere we've got a microphone that can come around so we can capture that. Kevin is also monitoring the Zoom chat, so if we get questions there. So if you've got a question for the panelists, raise your hand. If not, I'm gonna jump in with something, and I don't want to dominate that. So please, anyone have a question for any of the panelists off the start?
In all of your discussions, the thing that came to mind was that recent paper, I'm not sure, it was one of the Nature journals, where they looked at the effect of the loss of bats on the mosquito population, which I only got as far as the abstract, so. Increase in mosquito decrease in bats resulted in increase in mosquito population. Farmers started using more pesticides, and they show that that's correlated with an increase in infant mortality. You know, and all the things that you're talking about, you could imagine so many scenarios. How do we get this kind of information out to the public? Because really, we have data, we need to have action, right? And I don't know how well that's going over. So any of you, that's my question.
Yes.
That is such a great question and such a good paper, and it's happening all over the place. You know, I think firstly, broadly, again, speaking super generally about our species, I think we have a lot of good intentions and a lot of good ideas, and we often don't think them through. And until now is when we're seeing the, you know, domino effect of all of these different things that were not expected from something like that. But I also think we as researchers definitely need to do a better job of getting out there and talking to people like they're people. And, you know, that's something that I have really tried to do, and I think is really important. It's something that I hold up highly in my lab as just as important as publishing in scientific journals, is to get that data out there in a public fashion, but also, you know, take it to people, right? I think there's a lot of stigma and things around discussing big, scary topics like climate change with the public in a way, you know, that kind of bypasses all the political stuff related to that. But truly, like, people are smart. And I think we as researchers, I will say this myself, I think we need to do a much better job of meeting people where they are and not treating people like they're ignorant because they don't know something or they may not believe it at this point in time, right? Because whether or not folks think about, believe in, buy into, want to talk about big capital CC climate change. You know, people know that it's been a lot warmer recently. People know how their gardens are doing. People know how the animals that they used to see and watch bird watching are not there anymore. And I think that's a really missed connection that we researchers could both use for data, but also reach back out to and just build connection as humans with our environment and all the things in there. So I definitely think it needs to come from the researchers as a priority in line with the grants, the funding, the publication, to make sure to take that farther and take it to community.
I mean, I'll say one step further. As a recipient of NIH grants, I am beholden to taxpayers to not only do that research, but communicate the findings of that research so that in a way that they can understand it. And I think, you know, thinking about the COVID-19 pandemic, one of the massive failures is the public health messaging failure during it that still continues today. I think people can absolutely appreciate and understand nuance, and one of the problems is trying to generalize and dumb things down in a way that then just becomes confusing. At the same time, though, I think we meaning educators, scientific community, need to improve scientific literacy at all levels, starting, you know, in K-12 education. If you look to vaccine hesitancy and how that's taking over and what might be coming down the pike in January, we need to educate non-science folks on how to call, and maybe even people with a science background, how to call bullshit. Because there is a lot of bullshit that permeates out there, and wading through it to find out what is legit and what isn't is difficult in kind of the information ecosystem that we live in currently.
Yeah, I think just to add that the value added by community knowledge, local knowledge that exists out there, I think is really underappreciated. You know, I think about our indigenous community members who have really stewarded land for, I mean, generations and generations, time immemorial, where, you know, we hear things like, you know, these choke cherry stands are just changing. They're not there anymore. And this is like a traditional food for us. The plums are ripening earlier, you know, wild plums. And so I think that as a first source, you know, it's probably an important indicator, you know, for changes that are happening within that ecosystem, you know, within this web that really is dependent upon each other, you know. So I imagine in that instance, if there's a community member that noticed, like, oh, there's not a lot of bats anymore, what's happening? You know, maybe we could have followed that path and that trajectory to say, like, wow, that mosquito population is getting a little bit out of control. You know, and to me, it's fascinating. Like, I'm a social scientist too, went back for my public health degree. And I think it's as beautiful as it is tragic to see some of these connections form that have been there for us as researchers, as a scientific community, but we don't lean on it enough, whether that's our interdisciplinary connections, the potential for change, you know, that we can be a part of, and really meaningful and important change because of the silos that we work in, because of the budgets at our department level that discourage these collaborations between colleges, between universities. And that's NIH grants, that's funding. But then on the other end of it, we have these corporate interests that are also kind of impeding our ability to do this very transformational research. You know, so I do think, you know, there's an orientation towards justice that we need to be a party to in our scientific community as concerned citizens, moving forward, not just in the next 4 years, but I think climate change is going to force us down in that direction, because I don't think there's going to be a choice, to be honest. You know, there's, I feel like, as you were saying, you know, we're not too far away from a time where there's going to be one solution, and it's breaking down these barriers to figuring out a science that is going to, you know, going to be important, you know, not just for us, but for our recreation, for our animals, our pets, you know, our plants, our gardens, all these things. And hopefully we're, you know, we're on the way, we're on the journey towards, you know, reconciling all of those barriers. We'll see. Yeah.
Another question. So bring the mic around. Yeah, I think adding to that is the necessity to connect things to, you know, how climate change affects individuals, right? You know, it's one thing to say, well, it's a little warmer this summer, I'm going to get a couple extra days at the beach. But if you know, if the other side of that is, well, when I go to the beach, I can't now go swimming because of the algae bloom, right? I mean, so.
Well, actually, my question is related to exactly about this, to a question to Dr. here. You mentioned earlier about this harmful algal bloom. Because we are a state, you know, proud of this over 10,000 lakes. And the temperature increase in our state is already up to, you know, 3 degrees. So way above that, you know, the 1.5 degree limit. By the end of the century, we already got a 3 degree increase here. I'm wondering if you guys at a public health school done work, you know, see how the situation, current status about this harmful this algal bloom in our state, because we have so many states, and we know in the East Coast it's a big problem now, right? East Coast regions, this HAM producing have a lot of maybe consequence or at least correlations. You see a high incidence of this some disease, including this neurodegenerative disease like Alzheimer or ALS incidence rapidly increased surrounding that lake area. I'm wondering if you guys have any data or anything.
You know, I'm not sure. You know, first, I think, you know, of course, that's a concern, and I think it's just devastating, like some of the loss that we see because of that. But also, I think our recreation. For me, I think some of the concerns for our native communities in the region is, for example, like water temperature and like wild rice, you know, and so like what are the impacts on some of our rice beds, some of the species that are important to those ecosystems inside of the rice beds. And so that's about as much. I don't know exactly who is doing the algal bloom research, but I've heard that there's investigators around here, and certainly there's investigators, you know, in the U.S. that are doing that. Does anyone else want to answer that? Yeah.
I do not do that. And I also don't know specific names, but Duluth is a big hub for this, actually, with its closeness to Lake Superior. So I just want to shout out some other system players. Up there, they have the Large Lakes Observatory, which is actually home to one of the only, like, I think it's NSF, federally funded research boats that isn't on an ocean. Like, they're doing really amazing stuff. So there's a lot of folks there. NRRI, the Natural Resources Research Institute, is up there. There's an EPA office up there in Duluth. And folks at all of those institutes there, sort of partnered with UMD, are working on, there's a lot of people working on this exact question, both for a couple of One Health reasons, both because, you know, many of the folks up there, including most of the city, gets their water from Lake Superior. And currently it is too cold to have these toxic algae blooms in Lake Superior, but as we mentioned, water temperature is rising. And then secondarily, I know it's a big interest for like the Minnesota Climate Adaptation Partnership and folks like that, thinking about the tourism piece as well, and you know, continuing to make that a healthy area to invite others to. So unfortunately, I can't come up with a name off the top of my head, but those institutes up there there's definitely lots of researchers doing
For
that work.
these big lakes like you guys have there at Duluth, probably the temperature not affect too much, but we have so many smaller ones that temperature, water temperature, a pond, a lake could rise rapidly. And I know this dinoflagellate, that algae pop not a big problem here as a red tide or red waves, in the coastal area. But this blue-green algae or, cyanobacteria could be, the freshwater thing, very likely going to occur here. And this kind of bloom can produce toxins, especially someone could be airborne, could be in the air. Part of this air quality issue. So everybody could inhale it. And that's, there are a lot of mysterious disease nowadays, for kids like autism, or neurodegenerative disease, even ALS recently increased a great deal. People try to figure out what's the reason. And you talk about contamination, air pollution, everything. And then don't forget about this whole climate change. Maybe there's something related to water, something else, toxins in the air. Yeah, I think this kind of study could be done.
Other questions? Got one in the middle here.
On Zoom.
So we have a question on Zoom from Dr. Maxim Sheeran, and it's a question that sort of came to my head as well. I think it's a great one. You were speaking, Dr. Hill, about how indigenous peoples have been stewards of the land for a long time, possibly, as long as people have existed. And, something that struck me is thinking to, when Al Gore put up the temperature over time, and, in the movie that the name is escaping, that time frame was only for recorded history, right? Of course, that's mostly Western recorded history. And indigenous people, though, have such a rich tradition, a rich oral history of stories that might contain a lot of information about how climate has changed over time for much longer than we've been recording it, with a thermometer. As well as how people have responded and the environment has responded to those changes. And so, Maxim's question gets into that, is like, sometimes these stories are just kind of passed off as folk tales, but there could be a lot of really valuable information contained in those. And so could you maybe just speak to a little bit about efforts or any insight that you have about extracting some insights from those stories on how we can tackle these problems that are arising?
Extraction. It's the only word I heard. No, I'm just kidding. No, I think, first and foremost, it's like, there needs to be a really solid partnership and reciprocity when we approach Native communities. And of course, I do think there's a lot of rich information, in traditional knowledge systems that could provide so much substantial support for a lot of our adaptation mitigation programming. That we're moving towards right now. And I think the most important thing to think about and consider is that it's really low for intervention. It's going to be regional and local. So if you can imagine, ripples from when it's raining on a body of water, like that's what it should look like when we're doing these adaptation and mitigation programs. Let's say, because of the ecosystems. So it's the way that I think about it with our P20 grant, for example, when we're looking at indigenous and our climate change in rural and indigenous communities, is that we want to engage indigenous communities first and let that knowledge kind of ripple outwards to our rural communities for, whatever programs and research that we're looking at. So first, what we're doing is a climate change and health research agenda with our indigenous key stakeholders in the region. And I will say that a lot of these stories are what we think about it is really rooted in this set of like personhood and existence that is really cosmocentric, right? And so, for example, planting seasons have historically been governed by whether or not stories about our celestial systems, whether or not you can see a constellation at what point in, in the calendar. So like as an Ojibwe calendar, for example, we just finished, wild rice season, which is through Manumanike Gizis, which means that's the wild rice moon. That's when you go out and harvest wild rice, right? And so if we start to really organize our communities accordingly, we have systems and organization to the times when we plant, to the times when we harvest, right? There's also truth to this idea that storytelling involves a lot of moral value, right? But it's within the context of something that we might consider like a folktale. So sometimes you might hear a story told where you'll say, oh, that's nothing more than, it sounds like Paul Bunyan, right? It sounds like a Paul Bunyan story. But within that, there's so much context about, spirituality, about culture, but it's about, some of these really important values that Indigenous communities, I guess what I'm thinking about is our Anishinaabe communities, we really practice day to day. Humility, for example, so I think that's kind of just an introduction to what I would think would be practical for us as, students, as learners, as scientists, to be able to, one, approach Indigenous communities, and it takes time to develop a relationship of that nature, and then to be respectful in a transactional, really just is reciprocity that we need to engage in. Hopefully that made sense. And, it's a big question. It is a really big question. I think a lot of our communities are grappling with that because this context of really this Anthropocene or anthropogenic climate change is something that we're all grappling with. But then this idea that Indigenous community, Indigenous knowledges can help us all is also a big one too, when there's this history of violence that you have to get over to say, oh yeah, now it's our turn to help, so it's big.
I think we've got time for one more, maybe? Someone, yeah.
That was fast. Here, I'll pass it.
I was interested in hearing a little bit more about the cemetery work that you're doing and how those problems are already affecting the community, and if you have like a timeline on when those kinds of diseases, if the problem wouldn't get or isn't fixed, like what would happen?
Great question. Gonna just start this off with, I am not a vibrologist or any of that. I'm a social scientist trained in human remains removal. So essentially this kind of came out of the blue as, people just kind of learned the qualifications that we had, and they were like, hey, this is a problem that we need help with. And I wanted that community-led thing to happen. And so from a climate modeling perspective, unfortunately, it is bleak. Like they are truly, like I will occasionally receive a text message and it's like, help, there's human remains on the beach. Like, what do we do today, right? And hey, I can see 3 or 4 coffins in the escarpment because a typhoon just came through and they're gonna fall. Like, what do we do now, right? So there's that level to it. And then there's an additional level where we've been attempting to utilize a lot of historical and archival work. So we've been in a lot of the archives in the universities and communities up there to firstly try to figure out how many folks died from specific epidemics in a specific place and where were they buried? And at how deep at that time were they buried? Were they buried below the permafrost level at that time, right? So that work all has to be done. And then there's kind of all right, and how much has eroded since 1820, right? And so what we're finding now with some of my colleagues that are out there doing some of the cemetery removals in the really tough places is many of these coffins, they may be only between 5 centimeters to half a meter down when they originally were 2 or 3 meters down, right? And so, you know, we can do that and project out with climate change, worst case scenario, middle scenario, whatever. Fortunately, we are currently on RCP 8.5, worst case scenario. How quickly is that permafrost table going to melt? And is that going to become sort of active soil that maybe freezes and thaws throughout the year, but is no longer permanently frozen? And it truly is like right now, like we're looking at 2030 to 2035 as the boundary for basically things above about 1 meter in that region being no longer frozen. So it is a huge problem. The other piece to it and is that people don't know. You know, there's been a lot of studies in the lab of things like influenza or smallpox after 100 years. Oh, we found it in a -80 freezer. Is it still viable, right? But to my knowledge, there has not been that work done on actively changing ground, right? So even though permafrost is permanently frozen ground, there's a dynamic there, right? Where the top layer sort of melts and refreezes every year. And it hasn't yet really been looked at. So truly right now we are working, my team and telling the community is working from a sort of best case safety, biosecurity. If there are human remains, this is what you need to do to be safe if you have to deal with them type of level. Beyond that, we suspect that there could be risks from some of these diseases, potentially, if they are viable, but we don't know that yet. And I don't know if you could speak to any of that, but that's sort of where we are, is there are a lot of unknowns.
Yeah.
Yes.
Yeah, yeah. Yep.
Yeah, that's actually at one of my study communities, Brevig Mission, Alaska. That happened.
So,
The 90s.
Obviously we're out of time. We could obviously continue this discussion for quite some time. If you would join me in thanking our speakers today.
This one's for you. From the research office.
Well, I think it's students. They need to get to class, yeah. So. Awesome.
Really appreciate it.
Yeah.
Yeah, an hour goes really fast. Oh, yeah, I mean, we weren't sure if we were gonna get it, but we were getting so much like. We don't have this.